owe you a call back, and I was going to call you today to see if you have time in the next day or two. So I'll send you a note with some
That sounds
time.
great. I know how busy everybody is, so no worries.
Yeah. So. But I do think of you every time we get on the Peloton.
I've been trying to do that a little more frequently with all this sheltering in place.
Yeah.
Hi, Dina. This is Clay Armbruster. Hi, everybody.
No
Hi,
worries.
Clay. How are you? Hi, Janet.
How are you?
Good.
Good afternoon, everyone. Hey, Dina, it's Mark Terrell.
Hey, Mark. How are you?
Hey, Dina, I'm well. How are you doing?
I'm doing okay.
All right.
Hi, Dina. This is Uday here.
Hey, how are you?
Calendar Business Alliance.
Nice
Thank
to
you.
see you. Thank you for joining. We appreciate it. He's a new member of our group today, so we're very happy to have him with us. Hi, Sam. Hi, Gibby.
Hey, Dina, this is Charles Bowman calling in for Andrea Smith.
Hey, Charles. How are you?
I'm doing well. On a Monday?
Yeah, pretty Monday.
Hello.
Hello.
Michael Marsicano.
Michael, how are you?
I'm well. I hope you are.
I am. Thank you. Jennifer Appleby, I saw you dialed in. Good to hear from you.
Thank you. Good to see you. Thanks for all you're doing, Dina.
You're welcome.
Jennifer, I think we need to have some big celebration dinner when this is all over for Dina.
I agree with that.
I agree with lots of good wine.
Okay, so let me just remind everybody that we are streaming live on YouTube today, the audio portion of our meeting. So
Thank you.
you're welcome.
Thank you for that reminder.
We'll just give everybody a couple more minutes just to join. We got a big group, so. Hi, Andy.
Good morning, or good afternoon. How are you today?
Good. Thanks for joining. Good to see you.
Yes, ma'am. Thank you for having me.
I hope you don't mind that I sent your stuff out to the group.
No, ma'am. That's fine. No, ma'am. No problem at all.
Gary Green.
Carol, how are you today? Hi, Fred.
Hello. How are you, Dina?
Good. How are you?
Doing good. Thank you.
Okay, it's 1:01, so I want to be respectful of everybody's time today. So I'm gonna get started. I'm just gonna start by introducing the group. Everybody is here today. This is our second meeting, and if you're just dialing in, I just want to remind everybody again that we are the audio portion of our meeting is being streamed live on YouTube today. So I want to make sure everybody's aware of that. There's a few things that I wanted to go through today. The first of which is the revised order that Mecklenburg County did late last week. It went into effect on the 30th, which was Thursday. And it was really reflective of the conversations that we had last week around some of the changes that we potentially wanted to talk about and see happen. And so I think the major differences between where we were and where we are is we took away the restrictions that we had on realtors, which is what we had talked about. We took away the restrictions that we had on auto dealerships. We had some fairly significant restrictions on how they could operate. We did go ahead with the curbside retail, which this group was very supportive of. We took away the restrictions that we had on landscaping. Initially, the only thing that we were allowing was lawn mowing. but now under this governor's order, all landscaping activities are permitted. And we did allow tennis to start to play consistent with USTA guidelines. We were getting a lot of pushback around that. I think one of the most important things is that the mass gathering number is still restricted to 10. So there is a requirement that we continue to social distance as we move forward. So that's kind of where we are. But we know that on Friday, we are slated into going into phase 1 of the governor's order. And so one of the things that I wanted us to try to talk about today is, how do we get ready for phase 1? What are the things that we need to be thinking about in terms of phase 1? And I think that probably the most important aspects of phase 1, and I included this document in your package that I sent out to you, is that what we're calling discretionary retail will allow to open. And that means that all of our shopping malls will open, as well as all other retailers will be able to start operating. I assume it will be on May 9th because we go into phase 1, I guess, on May 8th or May 9th. We are still waiting for a lot of guidance from the state in terms of what phase 1 will really look like. We did have a call, Gibby and I did yesterday with Secretary Cohn and started to ask some questions about some things. And I think they're working this week to try to figure out what exactly phase 1 will look like. But I think that one of the most important phrases in the document is that the stay-at-home order will be modified. It's not lifted. So what that means is that the expectation as we understand it today is that people will still be required to stay home, but will be allowed to travel for these other activities. Again, we're waiting for some additional guidance around that, but that's sort of the way we read it today. Again,
Dina, this is Mike.
Yeah.
Mike, can I ask a question? It's Michael.
Sure, go.
Wasn't the governor's first phase predicated on certain criteria being met? And are we coming anywhere close to that?
I think we are. I think initially the data was supposed to indicate a 14-day reduction in certain metrics. And I think after evaluating that, what they're looking for is to see that those metrics remain stable. And if you look at the data, and Gibby's going to go through our Mecklenburg County data a little bit later, we are seeing that the numbers are stable. I think all indications to us is that we are going to move into phase 1. Something could change, obviously, but again, every indication that we've seen so far is that we will be going to phase 1 as of May 8th.
Thank you.
Mm-hmm. And so I think, again, some of the most important parts of this is that the mass gathering piece still is at 10 people. And there is a continued recommendation that people wear face coverings when they go out in public. And so I think those are two of the big factors that we're going to have to continue to watch as we move forward. Again, employers are continuing to encourage teleworking, rigorous restrictions on nursing homes and other congregate care facilities, parks our parks are already open, but state parks have been closed. So I think that means that state parks will reopen on the 9th as well. So that's sort of a summary again of what phase 1 looks like. And that's what we're heading at the end of this week. And so I think for us as a group, the biggest conversation I want to have today is around how do we want to message guidance for retailers. And what I put in the package today was really good guidance that Andy Eller from the North Carolina Retail Merchants Association has put together and has submitted to the governor's office. And by all indications, based on the conversation we had yesterday with Secretary Cohn, they really like these guidelines for retailers. And so I wanted to spend a little time today talking about those. And if I can put Andy on the spot a little bit, if he wants to maybe just walk us through them just briefly so we can get everybody level set on those. But really for us, I think is how do we want to communicate this out so that we make sure that we are, consistent in our messaging around these guidelines. And if anybody has any questions about them or there's any concerns people have about people being able to comply, if there's certain restrictions that may be onerous and have to businesses in their compliance of these guidelines. So with that, I'm going to ask Andy to kind of walk us through that, and then we can have a conversation about them.
Thank you, Dina. Let me get that document back up. Give me 1 second. Okay. So again, I'm Andy Allen. I'm President General Counsel of the North Carolina Retail Merchants Association. Have probably read more orders, state and local, than I probably ever wanted to. I hope at some point I never have to read another one again, because I read them from all over the country and all over the state. And so I was on first as a point. I was on a national sort of task force with the National Retail Federation, the Retail Industry Leaders Industry Association, that looked at what I'm sort of referring to. I don't call them essential and non-essential, but more discretionary retail. We sort of have this feeling that everybody that's providing a job in some ways, just maybe it's in a discretionary way. So I was on a national group that put together something, and I will be honest, it in some cases it went further than the document that you had before you that we sent to the Governor Cooper last week. And we had been in talks with Governor Cooper and Secretary Cohen about this right before we sent this letter. I did want to say we rolled out a 13-week statewide radio campaign focused on shopping safe for people, and to maintain your distance, bring a face covering, make sure that you wash your hands, don't go shopping if you're sick, that sort of thing. So that rolled out as of last Monday. And then Secretary Cohen and them have also looked at some of the other messaging we've done. Then we've also done a little bit of messaging around once we do end up reopening with some of these discretionary type retailers to try and support the people that are in your community as retailers. They're trying to do the right thing. So in this, we had a committee that we pulled together at the request of our board chairman who works for Tanger Outlet Centers, and it included a bookstore owner, a high-end clothing store, a furniture store, a mall operator, and then a couple of boutique type stores that were involved in this sort of trying to put together a plan and looking at a lot of national plans, and looking also at plans from places like Ohio, Ohio, Alabama, Georgia, different places. Some were, again, way ahead of where we are in this process, and trying to get sort of a plan that was, and we believe, responsible should we hit the metrics that on May 8th/May 9th, these retailers could open back up. So some of the things we borrowed actually from Governor Cooper's executive orders 121 and 131. And I will say a number of our retailers that have not been open have learned a great deal from the retailers, like in the grocery, hardware, and pharmacy space that have been. Those retailers have tried different things. They've been required to do different things, and they've learned quite a bit. And we had a couple on this committee. We had a couple of retailers on that call that have been operating already because of the type of business they were in, just to give some advice on how to put this together. But again, we put together sort of a list of 9 items, which were 6-foot delineations, point of sale, high traffic areas, the things that you've seen currently. Either, you've seen them with a decal in some cases at some of the larger chain stores, or you've seen them with delineated with X's on the floors, or certain areas for customers to stand, or an area where there may be high traffic. The sanitation guidelines in accordance with CDC, especially on high volume areas, pin pads, high touch areas, thinning of counters, that sort of thing that you may see. Signage requesting customers not to enter the retail location if they have symptoms of, shortness of breath, dizziness, cough, fever, not to come in, and to maintain their social distance once they got in the store. And then we started out with the occupancy requirements of the current ones that are in Executive Order 131, which was 20% of fire capacity for customers, or 5 for every 1,000 square feet, and then moving in phase 2 potentially to a little bit more expanded one, potentially of 50% of stated fire capacity, which I think is what Illinois just did, or 10 customers for every 1,000 square feet. Again, the first part of phase 1 would be to utilize the current occupancy requirements that are listed in Executive Order 131. 6-foot delineations on the outside of buildings, should you get to those numbers. And then the one we had we had the face coverings, when it's determined that employees cannot maintain 6 feet of distance between themselves and customers, or themselves and other employees. Hand sanitizer provided where available. As you know, that has been in some cases in short supply. It's becoming more readily available as people like distillers and others are making more of that product. Some form of a health screening questionnaire for their employees of, again, do you have shortness of breath, respiratory issues, coughing, sore throat before coming into the place of business to do daily on that. And some of them are doing it, I will say, through an app process that shows up on a dashboard. I've talked to a couple of very small retailers that are utilizing that so they can track all their employees and have their employees fill that out every day before they come to work. And then the social distancing requirements that were included in Executive Order 121. And those were the ones that was Section C1 that Governor Cooper had in that piece. Again, just maintaining the 6 foot distances, cleaning, sanitizing, that sort of thing. The one piece that, and looking at this was, we are looking, I think the governor's office has looked at, should we have a statewide approach or a regional type approach? I will say for consistency purposes, it's easier on people that are operating multiple jurisdictions to have one set of rules that they're trying to deal with. And then there is a fair amount of litigation going on already concerning COVID-19, and something that says that these requirements don't create a presumption, a legal presumption or a private right of action to sue somebody because they're 5 feet rather than 6 feet, or that they health screening does not meet up to the requirements necessarily specifically of this. We still want everybody to do it, but not create private rights of action and litigation in this. I will say that last week, Wake County pulled back on their order, matched it up with the states, and there were a few retailers that were allowed to open with that. We worked a couple of women's boutiques last week of things that they needed to do to walk them through this. And I will tell you that talking to them, they were open Friday and Saturday. They saw a little bit of customer traffic, but I think you still have customers out there that are still hesitant about going out, and we want people to be safe, so that is okay, certainly. But they were implementing this, and I asked them, these were 2 independently owned boutiques, how hard was it? And it was, they really did a good job on social media of educating their consumers, educating their customers that when you showed up at their store, do not bring your children. Make sure that you are not just picking things up to pick things up. They were messaging it very well. So I think to the question that Dina had of, are these things that retailers can comply with? I think that these are all items that are reasonable and are, again, a lot of them were in the executive orders previously, 121 and 131. And then a couple of additional ones that we've made based on some local orders that we have seen in certain places like Durham and Wake County and some other places. We've tried to put some of those items in as well. But Dean, I'd be happy to answer any questions. That was probably a little longer than you may have wanted. So.
No, that was great. I know people probably have questions. I'm going to ask one question though, and that's around face coverings.
Yes.
We, in the order that we revised, we allowed for the curbside retail, but we did require that employees wear face coverings. Is that, you have it in here as if they're available or they can't maintain social distancing, but did you think at all about requiring employees in these retail outlets to wear face coverings at all times?
We did, and I will say part of the issue still is a backlog of supply chain on the face coverings. And some of the experience that we found is some people, when they have a face covering, whether that's a scarf or a T-shirt that they've cut up or something like that, that they think there's more protection than there may be, and they end up touching their face all the time. We were more interested, I think, in making sure that the people that had them had good quality ones. And as that supply chain comes in, I think that will be something you're seeing people move to. I just saw Lowe's is now requiring all their associates to do it. I think you'll see a fair amount as they can access those that will do that.
Thank you. So who has questions? Yes, who did?
Dina, this is Uday here. There's a question from a couple of folks from our organization around EBT food stamp acceptance for hot foods. Is there anything in that consideration, Andy?
So we have been working with this. I'm sorry, go ahead.
Yeah, because we have done that in storms and hurricanes earlier, right? So any discussion around that?
So we have, and I've worked with that on the hurricane side as well for the grocery and convenience store. The Department of Health and Human Services has been working on that, and I believe has applied for what is called a hot food waiver. not always hot food. It can be prepared food as well, like potato salad and that sort of thing. I know that they have been in discussions with the federal government on that, but they have not gotten approval yet for that waiver. But that has been something that's certainly been discussed. We've been having a lot of discussions with the state around it. You will see, I don't know if how much of you have online SNAP, which is getting ready to go live in North Carolina tomorrow for the very first time for food stamp benefits. And then secondly, because of the school nutrition program, you were going to have, I think it's $155 per child per month that is going to be put onto EBT cards loaded on there so that you will see children nutrition-wise be able to get that through an EBT type card that if you're already on EBT, you'll get it loaded into your account. If you don't, they'll send you a new card for that child that will, and to put it in perspective, there will be more money flowing into the state from that program than for the current program or the entire month of January for SNAP benefits. It is a tremendous amount of SNAP benefits flowing into the state that started last month, and then the new online one starts tomorrow.
Thank you, Andy.
Thank you.
Other questions?
I have a question about small businesses, especially when it comes to this reopening. Andy, I don't know if you have, I just asked it in the group. Are we expecting that retailers have a point person at the front of every store counting capacity and or telling people to wear face masks? I was yesterday was my first day back in a grocery store, and it said to wear a face mask, but there was nobody at the front basically telling you to do it. And when I got to the register, the young girl was really upset that probably 50% of the people in the grocery store at the time were not wearing face masks.
Okay.
So as I own a small boutique, and
Right.
so we're just trying to figure out from a staffing perspective, do we have somebody at the door at all times counting people, making sure that they're kind of following this protocol? And then also, how can I have somebody standing at the front while also keeping this safe distance in a really small, I mean, we have a 900 square foot store, and I think that's probably a question that a lot of other small businesses might have as well. Thank you.
So in Governor Cooper's Order 131 that would put the maximum occupancy requirements in there, if you look at the requirements about counting customers, what they basically said was, if you reasonably believe that you're going to get close to the number of the maximum occupancy, then yes, you need to have somebody there. If your maximum occupancy is 35 people and you have 4 people inside your store, you don't need to station somebody out there just to stand there. That is, and Governor Cooper's, at least in the first order, was very cognizant of that. He said, I don't want a hardware store, somebody else, a convenience store. There's nobody in the store for them to have to take a person and stand them out front just to stand them out front. Now, if they start to get customers, then yes, we need to work on getting somebody there and making sure they're not exceeding it. The facial covering, again, I think it depends on what the store is. Some stores are requiring you. I know Fresh Market is off the top of my head, and I think Costco are requiring people to wear facial coverings. Not everybody else is. I think that's certainly something in your messaging from both social media wise as well as on the store at the front that you can certainly emphasize or have some sort of person, noticing that. For the first time yesterday, I was in a store and they had the loudspeaker of, please make sure if you have your facial covering that you got it on, stay 6 feet apart. They were doing that over the intercom a little bit every 20 minutes or so. I will say the one boutique, one of the ones that opened this week, their maximum occupancy was 35 people, and they decided to start with 10. And so she said, I wanted to see how this works inside my store. So she stair-stepped it in voluntarily just to so she could manage it, accordingly. And she didn't want to get anywhere near the 35 number that she had about counting people. So I don't know if that answers all your questions, but I think for the most part, looking at some of the blueprints of some of the things that you're in there, these are things that have been done by some small businesses like hardware stores that have been open already or convenience stores that they've been able to navigate fairly easily on some of it. Some of it's taken a little more time as far as making sure that they're educating both their employees and their customers.
Thanks, Andy.
That's a good answer. Thank you.
Thank you.
I think I think those are good things that we may, because I think one of the things that I'd like to see us do is maybe create some guidance that we can put out that takes in, like maybe an FAQ or something that takes all of these things into consideration. And maybe that's one of the FAQs that we can put together, is sort of this whole notion of, do I have to have somebody standing in the front or not, and how do stores manage that? And guidance around the face coverings, because the last thing we want is for people to be confused.
Right.
And so the more clear we can be on what we think makes sense, I think we'll be better off at helping our community adapt to what happens on Friday and beyond.
And Dina, we'd be happy to help you with that as well for some of the questions we've seen so far in certain areas.
That would be great. That'd be really helpful. I did get a
So
question.
Dina, how do you get that word out to everybody, both the customers and the retailers, so that they all how do you get it out?
Well, we have to figure out how we do that. I mean, I think Andy's got a really good network of retailers that we can start with, but obviously, we'll do a media availability and, we'll talk about it there, and we can push it out on social media, on our website. We'll find a million ways that we can push that out. And we'll probably have to keep pushing it out. I don't think it's a one and done. I think we'll probably have to continue to do it the next several weeks. I did get a question on here as well about personal care businesses, if they have to remain closed, and they're not slated to open until we get to phase 2, which will be at least 2 weeks after phase 1. So all personal care salons, nail salons, spas, all of that have to remain closed until we get to phase 2.
Hey, Dana, this is Jesse. I don't have so much a question, just again to pile on a little bit in regards to the face masking. I would just, as someone from the healthcare system, would just really like for us to come as close to a mandate on retail face masking as we can. If we can't mandate or enforce at least a very, very strong high requirement that as people are matriculating in retail outlets that they have face masks. And so again, we think that this is going to be more protracted, meaning as we continue to watch COVID and the amount of people that may be admitted to hospital systems, we just want to be very conservative around that point. And I just can't put enough emphasis on that piece, that's the tenor of the county around face masking. Thank you.
Okay. That's really helpful, Jesse. Thank you. We'll make sure we
Dina,
Dean, I had a question for you.
Mohammed, did you have a question?
Yeah, I know we talked about tennis last week. Can you explain to us what the difference in policy in Mecklenburg County is versus the rest of the state as it relates to single occupancy of golf carts? I know I've gotten a lot of calls from different people that are asking, why do I have to leave Mecklenburg County to play golf? Because we all know that if I'm going to play golf with my daughter, we're sitting in the same car, or people with their spouses, or normally all people that go play golf, they know each other. Can you tell me what the difference is between what they're doing in the rest of the state versus Mecklenburg County?
Well, I mean, Gibby's on the line and she can help me with this as well a little bit. I mean, we started out with the requirement of one person per cart, just because we felt it made more sense to make sure that we didn't have people interacting, particularly if you didn't really know the people you were playing with. That is not the case now in the rest of the state and never has been, but that's something that we can take another look at and see if we want to make a revision to it. But I think you're right. We're probably the only people in the state still that have a requirement of one person per cart. But we can take a look.
And I've heard from a lot of the golf operators that they don't even mind asking people to wear a mask because practically everybody that goes out there and plays golf, they know each other. But I appreciate you looking into that.
Yeah, I'll do that.
Dina, this is James with Not Just Coffee.
Hey, James.
Just to go back to the mask thing. So from what I understand, the masks are mostly protection for other people, right? They don't protect, it's more about protecting the other person and not yourself. So in the case of like making it a very, it's not mandatory. So, what we're running into is like all of our staff will be wearing masks when we reopen, but if it's optional for people going out, essentially our staff are the ones who are at risk, not less so than they are, right? Is that correct? Does that make sense?
Yeah, I mean, I think we have a lot of healthcare people on this call, so they can help me here. I think that the notion around face coverings now is that it really protects everybody.
Really? Okay.
It used to be that if you were sick, it was really, it would be for you because you were sick and you wouldn't want to infect other people. But I think we're at the point, and again, Carol and Jesse are on the call, that because so many people can be asymptomatic at this point, that it's
Right.
not clear who's well and who's not well. And so wearing a face covering really protects everyone.
So
Yeah,
we're
you know,
asking-
there's a lot of information out there, but it goes something like this, and Carol, keep me honest on this. But if someone is a carrier and they're not wearing a mask, and someone that's not a carrier is wearing a mask, even with the mask, there's a 70% chance that they could get the virus. The only way you get down to 1.5% is both people wearing masks. And so that's why it's so important that everybody wears a mask, not pick and choose. That's the only way you get it down to a manageable percentage. If there are people that are asymptomatic out in the public, no symptoms, it can be pretty impactful.
But we run into the question of availability, and I think that, it will continue to be an issue, I think.
Yeah, I think so too. This is Carol, and I think so too. Jesse, you said it very well, because the question was the right one. Unless everybody does, you really don't know what you're dealing with. And then the other factor, of course, is the type of mask and what it is, and the more tightly woven ones we know are better. So some guidelines around those might just be good for a reminder, but just the fact that everyone would have a mask makes it a much better playing field for all of us.
Dina, Dina, this is Michael Smith. What we're starting to hear from some major employers is a conversation about this as well when we bring employees back to work, not in a retail environment, but in the office environment as well. And I know this is something that we're going to have to contemplate is this a strong recommendation, or is this all the way to a mandate during some period of time? I know these are going to be hard policy decisions to make, but I think there are things that we need to be thinking about now, both in the retail and in the office environment.
Thank you. Janet, can you talk a little bit about your PPE match site that you're working on? Because that might be helpful too in this context.
Yeah, thank you, Dina. We are actually beta testing this. We partnered with Skookum. Many of you know Skookum. They're a home-based, Charlotte-grown company. And we're launching a platform in partnership with Greater Winston-Salem, Inc. To actually line up PPE demand with PPE supply. So we initially did this, I think, out of a request that Novant had, because Winston-Salem was doing this. And so we just made this a turnkey site. You could literally just fill out your information if you are a manufacturer in the region. And a lot of our manufacturers across the Charlotte region have actually pivoted to doing numerous amounts of medical grade PPE supply. And initially, again, we lined it up for our hospitals and our healthcare systems to actually have any needs and post those needs on the site. Just a couple weeks ago, we decided to open this up and make this available for any businesses who would want to request this type of PPE. So it's primarily local. I'll say local meaning across the Carolinas, North Carolina, and South Carolina manufacturers who would be producing this. So we're planning to launch this with a press conference this week, but the site is in beta form, and we will be promoting this out. I'm happy to send you and everybody else on the call a list of the site and the details once it's up and ready. But we expect to.
Janet, this is Ray here. Dina, can I ask a question?
Of course you can.
Yeah. So thanks, Janet, for sharing that information, because there's a lot of concerns from mainly minority-owned businesses in the city around the PPE requirements, and if you are making it a mandatory, there's a less supply, than demand, right? So if what the program that you're doing is going to really help those folks. And also, there are some small businesses that have started recently, especially people that have lost jobs, have taken up manufacturing of these masks at homes. So mostly tailors and all, some of the folks that are involved in that sector with the textiles. So I can share that information with them. I'll follow up with you after offline and to get the details. So thanks a lot for sharing this information.
Absolutely, happy to.
I have another question. I saw that about half of people that have died in Mecklenburg County are coming from long-term care center or assisted living center. Are we looking at the capacity at these places and maybe do something for people that are not sick and have them out of those places?
And this is Carol, and I'll jump in, and Jesse, please jump in too. This is when the health systems were looking at the whole state of the environment with COVID, one of the first things that we started looking at collectively was the vulnerable populations. So it's the homeless, it's skilled nursing residents, it's the jails, it's wherever it is that these patients are more vulnerable. So, for example, and Jesse, jump in, but I know that for us anyway, it was very important to get virtual care up and running, and to, when these patients were admitted, to bypass our emergency department and put them straight into a room in the hospital. But then what we're doing, and Jesse, I'm sure you've got things going on too, is specifically to your question, we have taken our Huntersville Oaks facility and put that in sort of chunks and segments so we could really put the COVID positive patients in one spot. So please know that you just hit on something incredibly important, and that's not going away. As we start getting people back, to work, et cetera, taking care of vulnerable populations and testing for those are probably some of the first things that we need to be doing. Great question.
So, Carol, I agree with all said. We're definitely working with nursing facilities to segregate where appropriate.
And I know that our public health team, and I know Raynard's on, I know Gibby was on earlier as well, but they've been doing, along with Medic, have been doing site visits to a lot of long-term care facilities in our county. They have made sure that they have enough PPE because they were experiencing shortages of PPE. The other thing too, just so everybody's aware, is that skilled nursing facilities are actually regulated by the state. They're not regulated locally. So also working with the state to make sure that everybody's being tested and that they've got proper PPE, doing everything they can to try to contain the virus the best way that they can. Having said that, it's hard if you're a standalone skilled nursing facility. You can't really move anybody anyplace else unless the family wants to take them home. So in a lot of ways, they are captive in those facilities, and we have to do everything we can to make sure they stay safe. So thank you for that question.
Yeah, Dana, I would just add we are certainly working very closely with all of them, and the only thing that the additional thing that we're doing is ensuring that we are that there's adequate testing for the residents and the staff to ensure that we are able to identify folks who've been infected and isolate them from others in the within the facility.
Okay, perfect. Thank you, Raynard. So other questions about the retail guidance, because I think what we'd like to do is, if with Andy's permission, is sort of maybe put this in a document and try to use this as a basis for some document that we can put out to the community as we start to move closer to May 9th or May 8th, whenever we actually pull the trigger here. And I got some really good suggestions too in our chat side. Toolkit information, and Jennifer's got some stuff that she thinks she can share. So we can put a toolkit out with signage and posters and other kinds of things, as well as put together guidance on the retail piece. And on the issue of the face coverings, let me do a little bit more research and talk to our emergency management folks to see if there's other things we can do around the supply chain around that. And we can't provide some additional resources. I just don't know the answer to that. And Gibby is on the phone. Her computer broke. Yeah. She's not visual, but she's audio. Did you have any to add on that, Gibby?
Yeah, I do want to talk about the face coverings for a minute, and we are trying to distinguish between masks and face coverings because masks typically refer to the surgical masks or the N95s that our healthcare workers and first responders need to have access to. Because it's more protective, and they're in close proximity with these clients, these patients all the time. What we're talking about for the community as well as for the workers are face coverings. And to be perfectly honest, they are fairly readily available. You can go on Amazon and order them. And there are some other providers that we're seeing every day that have ramped up to provide these. So I am concerned if folks are having trouble finding those. We need to know about that so we can help them access. And they're not terribly expensive either. So I would suggest that for the retail, that we are really looking at the possibility of requiring that and really recommending it for folks coming in. On the conversation with Dr. Cohen yesterday, the state is going to recommend that anyone coming out of their house have on a face covering. So I think to be consistent, we need to be thinking that way.
Kimmy, this is Jesse. Thank you for that clarity, because we are not advocating for N95, even as we're looking at lower filtration types of masks for teammates in healthcare that are not clinical in nature. They're more the mask, the general mask, rather than the N95. So I appreciate you providing that clarity.
Hey, Dina, this is Sam Good. Just one point on the face masks, and I hear everyone's points, but that, talking to sit-down restaurant operators, having reduced capacity is one thing, but also having people forced to wear a mask, if you pull people, more or less keep them closed indefinitely and legally permanently. Because they don't believe that people will go out to dinner and wear a mask. So just food for thought with the small business world out there. There's quite a few sit-down restaurants in Charlotte that would be impacted by this.
So let me also say one thing on the facial coverings, and this is by scale, and I will say that I'm working right now with emergency management as we speak on some facial coverings for employees. But when you sort of start to ramp, and you mentioned that they are fairly available, the issue you somewhat have is when you start to ramp that out statewide and every employer having to make sure that every employee has got a face covering. If you think about a store the size of Lowe's and you extrapolate that across the entire state of North Carolina and every single employee having it, or a store, and I'm just going to bring somebody like a Food Line with 525 stores in North Carolina, that every associate's got to have a face covering. Then when you start to pull that down onto the smaller retailer, you may have a supply chain issue as far as them getting it. We're encouraging people to have them, but you may have a supply issue. It's very similar to what we ran into with the plexiglass, which everybody would like to see plexiglass at the point of sale, but we ran into a shortage of plexiglass supply chain wise, and retailers that were trying to get it for their store for point of sale were unable to get it, and either the material or the labor to hang it for them. So that was my one, just trying to make sure people are aware that when you start, if it gets required statewide, there's going to be a big ramp up time on the face coverings to make that happen. They're available, here and there, but not in 20,000 increments, 50,000 increments, 100,000 increments like you're thinking about which would be necessary. The other thing I would point out is one thing we would ask is in some areas where, and the Durham folks were pretty good about this at one point in time, which is not making the retail clerk the police of you don't have a mask so you can't come in. People are already on edge at the moment based on their employment status, their family's health, that sort of thing. And I'm really hesitant to make a 17-year-old clerk at a boutique the police to somebody that says you can't come to the store without the mask. And so it just creates customer conflict in certain areas. I just put that out there as well, just based on experience that we've had so far.
Yeah, this is Jesse. Just a little.
Jesse, go ahead, Jesse.
Just I wanted to respond a little bit to that. First of all, I think in regards to face masking, that part of the energy from the county, if we're going to do an FAQ, Dina, is that what we're talking about are facial coverings that can be made at home. And there are a lot of easy do-it-yourself kinds of ways that you can do that. So if we're going to a mandate, I think that becomes part of the FAQ, how you can make these things at home. The second thing I want to mention in regards to retailers and people going into stores, my fear, more so than someone asking a 17-year-old to be at the police, is the outrage that I have seen going into stores with people that are wearing masks and people that don't have masks. And so that's where I get concerned. I mean, there are a lot of people that are offended because of what they're seeing people in retail, in stores like a Whole Foods or others that are not wearing masks. And so hence there's kind of this energy around encouraging people when they're out and about. I'm glad to hear Secretary Cohen is saying if we're going to transition, that we're going to ask anyone that walks out of their homes to put something over their face, particularly in proximity where they're going to be in a retail environment.
Dina, this is Rocio Gonzalez. Staying with the topic of the face coverings, some of our small businesses, just like everybody's having a difficult time having access to these products. I would like to hear a little more explanation or the difference between the regular handmade face coverings and also the ones that are the plastic that is supported by the forehead that kind of covers the face, but is still allowing the air to seep through under the chin. So some of our small business owners are asking if we are unable to find a regular mask or an N95 or can our staff and can our employees use this? What are the benefits? Would this comply with the requirements?
Gibby or Raynard, do you want to take that?
Actually, the concern about those, because typically in a healthcare setting, you've got a mask on plus a face shield. The mask catches the droplets. The face shield is not going to do that. It might block them a little bit, but there's still the potential for droplets. So the preference would be the face covering.
So it sounds to me like we need to write maybe some clearer guidance on this whole issue of face coverings and the different types of face coverings. And, we can certainly try to take a stab at that. I think at the end of the day, we need to see what the governor is going to recommend, because we have sort of made this decision with our policy group that we work with that we're going to follow the governor's, whatever the governor's guidance is, we're going to follow the governor's guidance. And so to the extent we can mandate would make us more restrictive than the governor's guidance, and that would be another decision that we would have to make, which would be separate and apart from what we're doing here today. So I think we can wait and see what those recommendations look like before we draw a pretty hard line in the sand about mandating or requiring face coverings.
Dina,
Dina, I would like to know if the healthcare professionals on the phone call believe we should mandate.
Dina, this is Dr. Lugo. Can I come in for a second?
Of course.
So I think what you just said now regarding understanding what the state recommendations are going to be regarding a mandate is very much on point. We run the risk of having disparity across different counties over this issue. We may have a very strict mandate in Mecklenburg County, which is completely different from Ashe County. We need to go back to the CDC guidelines that do recommend cloth face coverings under two scenarios. One is utilization of public transportation, and the second is in workplaces where social distancing cannot be maintained efficiently. And there's several of those paradigms where social distancing can't be maintained. Those are the guidelines from the health authorities, public health authorities, but they are guidelines. And we do have the flexibility to be more flexible or more restrictive. But the concern that I have is that if we have very rigid or flexible guidelines in one county, then we have total confusion. And I think it's very important that we do understand what Governor Cooper is going to say, and hopefully have some coordination across counties so we have uniformity. It's easier for the public to accommodate that, and also from a legal perspective, less likelihood for unnecessary legal issues.
Thank you. I do appreciate that. I don't know if Carol or Jesse wanted to make a comment about Michael's question about your view on mandate, just because I want to close the loop on that. No?
Jesse, go. Yeah. So my take, and I think Dr. Luco pointed it out well, is that we would we think that this is important. We believe it stops the spread. Mandating, saying that word and crossing that line is a different level. And can you get there? My question is, can you get there? This community has been pretty compliant. Can you get there with just a strong stance on how important this is for the protection of everybody without doing a mandate? That would be my take.
No, this is Jesse. I agree with Carol. Mandate is strong. I use the term highly recommend. followed by a lot of facts around why we're making the recommendation, all the things that we've actually talked about. Consistency around CDC, to Yele's point, I think is spot on as well. What I will also say is that we are within the healthcare industry. I'm sure it's true for Atrium as well. We are requiring masking for all of our teammates, and those are teammates that, whether they are within a clinical environment or office environment, and still we're having people stay at home. But even as we're thinking about bringing people back, we're issuing masks for our teammates because we expect them to wear them, with the exception of when they're in their offices, separate offices. But the matriculation back and forth, we're going to require and ask that they wear face masks.
And we are too, Jesse. I think, if you are not able to keep social distancing, then it's an absolute must. That's what we've said, and that's what we're sticking with. The other thing I would pose is, could you enforce a mandate? And if not, is it better to just go out there with a strong, this is what we need you to do?
Okay. Thank you for that.
And Dina, it's important.
Yeah.
Dina, this is Mohammed again. I think it's important for all of us to think about that, the fact that we're minutes away from York County. And whatever happens in North Carolina, we got to think about whatever happens with, in both North Carolina and South Carolina. We all know that many of the people that work in Charlotte, they live in South Carolina, York County, and around that area. I think that's another thing that we need to keep in mind.
Correct. I totally agree. And that also goes with, as our doctor said, Dr. Luco, that, Gaston County and Union County having different guidance than Mecklenburg County, I think also is not going to, I don't think that's going to work well for us here. So I think we have to sit tight for maybe a day or so. Hopefully the governor will come out with his guidance shortly. But based on what our call yesterday with Mandy, she did say that if you leave your house, you're supposed to have a face covering on, but we'll see if we get any more clarity around that. That's not a mandate, but it was a recommendation. We did get another question here, and I don't know if Andy, if your folks had talked about this, but for retail, particularly clothing, there's been a suggestion that every time an item has been tried on by a customer, should it be steamed for sanitation? When we look at like malls and shopping, department stores and all that, I mean, I can't imagine that's going to be the guidance.
So we, on the committee we had, like I said, a couple of boutique type and a couple of department stores. I don't think they wanted to put out a specific recommendation on it. I think that there may be some best practices. One retailer was going to sanitize and steam and hold for 3 days. Another was going to quarantine items for 3 days. It brings up some other questions around your dressing rooms, whether you leave your dressing rooms open, or do you, as soon as somebody leaves one, you have to go in and deep clean it. There may be a scenario where people just choose not to open their dressing room. There was an question around that, as well as around returns. If you take something to your house, what happens, whether it's clothing or something else? And generally in North Carolina, you're allowed to set, under North Carolina law, set your own return policy. We were encouraging people to be transparent with what their return policy is and if it has changed. But we couldn't necessarily find one that was a one size fits all for both of those items. I think certain retailers were doing it different ways, but I think we are advising everybody to have a very strict policy or a consistent policy on both of those of what they're going to do and be planning for that.
Okay, thank you for that. About that. Yep.
Governor Cooper mentioned today at his press conference at 11:30 that he may have something as early as tomorrow afternoon, or it would be Wednesday morning. And that may be consistent with what Secretary Cohen told me yesterday, but that was what Governor Cooper said this morning about 11:30 on his press conference.
Yeah, that will help us a lot if we can get that soon. So just to try to close out this particular topic, we'll try to take a stab at collectively putting all of the stuff that we've talked about together in sort of a document / FAQ that we can try to send out back to the group for comment. The other thing that I did also put in your packets were the guidance that we got, that the CDC put out for guidance for cleaning and disinfecting. I thought it was a pretty good document. So we may want to link that into our document as well. I think it gives some pretty good information about how to do it and when to do it and how frequently to do it. And so if anybody has any concerns about that, you can let me know. But I thought it was a pretty good document to get people started on putting together that reopening plan. Does anybody have any more questions about this particular topic or any other concerns? Because we do have a few other things we wanted to get through today. Okay, terrific. So as we talked about, at our last meeting, we were going to keep the data in front of this group in terms of our Mecklenburg County data. And so I'm going to ask Gibby or Reynard, one of the two, to talk us through the data that we sent out. Now, this is the same data that we published on Friday, but I also included a new curve for them to discuss as well. So I'm not sure if Gibby or Reynard is going to take that on.
I'll take an initial stab at it, and then Reynard can fill in if needed. I'm not going to go through all of the data. This is data that we provide several times a week. And as the manager said, this is from data up through 29th of April. So what you see is continued increase in the number of cases that we have had in Mecklenburg County. There is the graph. There's several graphs that have trend lines in them, and these are the trends that the state is looking at as well in terms of determining whether to move into phase 1 and then moving forward into phase 2 and 3. And the first of those is the daily reported cases. And as you can see, we have a 7-day moving average. And as you can see on this particular graph, we're pretty stable. We're not going up, we're not going down, but with the number of positives that we're seeing, it's fairly stable. The next graph is the percent positive of laboratory tests. And again, that number is fairly stable over the last 14 days. So again, stable is what the state is looking at in terms of making decisions about whether to move forward, either stable or decreasing. And the last one that I'll focus on is the daily hospital census of patients with laboratory confirmed COVID. And you see just a slight decrease there, which we're continuing to watch. So our numbers are trending in the direction either stable or down in the way that the governor and Secretary Cohen are looking for these numbers to move. In conversation with Secretary Cohen, we talked about the fact that in addition to what they're looking at the state level, that we'll be continuing to monitor ours here at the local level, and there was support for us doing what we needed to do locally if for some reason our numbers started trending in the wrong direction. The other document that Dina sent out was the actual curve that we had looked at before. And again, this curve looks at hospital beds, projected hospital bed needs, ICU bed needs, and ventilator needs. As you can see, as we flatten the curve in Mecklenburg County, which we've done a good job of with our social distancing and our stay-at-home order, that our projected peak has moved out into July. And so we're continuing to watch that, but the longer we social distance, the longer we keep our numbers down, the more that peak time is going to move out. And that's what we've seen over the last week, is it moving in that direction. So be happy to have any further conversation about the data. I didn't want to spend a whole lot of time because you had it in front of you. But Reynard, if you want to mention anything else or if there's questions that anybody has, we'll be happy to answer.
Reynard, did you have anything to add to what Gibby said?
Nope, I think that's good. If folks have questions, I'll jump in on those.
The only thing I would mention is, if you remember when we first started to report this out, we were reporting that our peak was going to be somewhere between early and mid-May. And so the fact that we have done the stay-at-home proclamations and have done the social distancing, you can see we've pushed it out mid-July, which is really the outcome that we were hoping for. So I think in that respect, we've done a good job there. I don't know if anybody has any questions about the data for Gibby or for Reynard.
So I have a comment. We've broken out this data into hospitalization by age, and we see a preponderance as expected of people above 60. It would help if we also broke this down into further segmentation that includes sex and race. The race issue will reveal the obvious. We do know that minorities tend to have more adverse outcomes from COVID-19, which is just a current iteration of the issue around healthcare disparities. But if we don't focus on those issues, then we lose the opportunity to continuously prick the social conscience of our healthcare systems in devising methodology and accountability as to how we can achieve health equity. So I know that the variables for the data sets have already been chosen, but I think we've missed an opportunity here for us to understand how we are performing, where the mortalities are, where the morbidities are, and what racial and gender segments are adversely impacted.
Yeah, so I'll say I think we are certainly monitoring those very closely. So we do disaggregate the count of deaths by race, ethnicity, as well as gender. You'll see it at the top of this. There are a couple of bullets that speak to that. We are not providing graphs to represent those because they're not extremely notable findings, but we are monitoring them very closely. So we do look at deaths and hospitalizations by race and by gender and by age group. We reported it by age group because we did notice a significant pattern there. But we certainly appreciate the real potential for racial ethnic disparities in all these outcomes. And so we are looking very closely at that across the county.
So to follow up to that, if we are looking at that and we are finding equity, then that is a very important thing to note. That tells us that our healthcare systems are doing something very unusual. And that there should be transparency and visibility around that.
Okay.
When I say
we're
unusual,
happy to-
I'm talking about expected. What's happening is a variant from what we're seeing across most large cities. It is what is expected. If we're ahead of the curve when it comes to delivering health equity, it should be celebrated and it should be advertised. And we should understand what the best practices are that is enabling us to do that. It's food for thought.
It's a great point, Dr. Aluko. This is Carol from Atrium, and this has been, I know, Jesse, for you too. When we speak with one voice because this is so important to us. And getting back to my earlier comment about you've got the vulnerable populations, but then you've got this crazy disparity that's been shown to be all over the world, the country for sure. And we really, we're hopeful. We're very hopeful. We're cautiously optimistic that we are better than most communities in this. And with the things that Atrium's doing with our roaming ban and with all the other things we're doing and all the things that Novant is doing, there's a lot of attention being placed on this. And you're right. In fact, we talked about that your very issue at noon today. How do we tell this story if in fact our hunch is correct?
Thank you, Carol. Are there other questions? Dr. Luca, we'll go back and pull that data and report that out because I think that's really good feedback. Are there other questions about the data before we move into testing? Because that's another piece that I wanted to spend some time on today. Okay, so as we've talked about, when you look at what Dr. Cohn has been putting out there in terms of what we need to see in order to move past this, one of the things is more widespread testing, and the other is contact tracing. And we feel pretty good about where we are in the contact tracing piece. We are still trying to put together a good testing plan. And I was going to have Gibby kind of talk through kind of where we are with that and where we think we need to be around testing and some of the questions that we still have as we start to put together our testing plan for Mecklenburg County. So if you don't mind sort of taking us through that, I'd appreciate it.
Sure. Yeah, we have been having some conversations internally and with the hospital systems about where we are with our testing in the county. We've also been looking at CDC guidance and having conversations with the state. I was on a call earlier this morning with the state around testing. And there continues to be slow movement on this, unfortunately, in terms of providing guidance that would be helpful to make sure that we're being somewhat consistent in how we're going about this. I worked with staff this weekend. We put together a sort of a draft plan and have a call with the 2 hospital systems on Wednesday to talk through that and to see where we are with that and what we may need to do to supplement what the hospital systems are doing, or whether they have the capacity to move forward with the direction that we're getting from the state in terms of the number of tests we need to be doing. The state is estimating that we need to practically double the number of tests we do every day to meet the expectations around testing. And part of the challenges with that are access to supplies and PPE. The state is working with the federal government to address those issues. We were told today that CDC is going to be sending an extra 300,000 tests to the state of North Carolina over the next, over the month of May in increments. I don't know what that's going to mean for Mecklenburg County, so I'm pushing the state as hard as I can to get a little more clarity in what their expectations are, but also guidance, because again, this goes back to some of the things that were mentioned earlier. As much as we can be consistent in how we go about this, I think the easier it is for our community to absorb and understand. But it also means that we're using resources in the appropriate fashion, recognizing that we're not in this by ourselves. So I'm hoping that after the call on Wednesday, we will have a plan outlined and we'll start moving forward with that. I do believe it's going to be critical for us as we move into phase 1 and on into phase 2 and 3 that we are able to expand the testing that we do in our county. We just need to make sure that we're doing it in a way that the folks that need it most have access to it, but also that there's agreement in the county about who we're making testing available to. Unfortunately, we're not a Los Angeles County yet where anybody that wants to test can get it. And the other challenge that we have is the lack of clear understanding around some of the parameters that determine who you test and how often you test them. That's evolving information too. So we're trying to put all those pieces together.
Gibby, because one of the things that Secretary Cohen said yesterday is that they're expecting each county to put together a testing plan. Is that expectation include us articulating how testing gets prioritized? Because right now we're doing people who are symptomatic and people who are at high risk. So what would be the next level? Like, where would we go from here in terms of who would be the populations that would be tested next? And is that something that we think the state's going to provide, or is that something that we're going to have to do locally?
So that's a great question, because what we heard this morning is that the state is working on a 100 county testing plan. But they've got a draft and they're going to take it through 2 or 3 different groups before it ever gets to the county. And I basically told them that, the horse will already be out of the barn by then. I mean, we're working on a plan right now. And we need their input if they're going to provide it right now. What we're looking at here in terms of recommendations for our hospital systems to consider with us is the possibility of a 2 to 3 tier approach to testing that would allow us to expand testing beyond what we're currently doing, but do it in a systematic way with some agreement on who really should have access to the tests that are available. So I think we will be moving forward with that, and we'll try to incorporate state guidance as it comes. But I don't feel like we can wait another week or 2 to get that guidance.
And Gibby, this is Carol. I just know that you've got our full support on that. We completely understand what you're trying to do, and it's not easy. We're prioritizing even within the healthcare systems. We're opening up a lot more testing, even for example this week. And it's not so much for us. It's not so much the machine, but it's the test kits. So I think you've nailed it when you described the priorities and how do we land on those. So just want to make sure you do whatever we can do. We're here for you.
Great. We have some of your folks on the call Wednesday, so I look forward to the conversation with them.
Thank you.
Hi, Gibby. This is Uday here. I'm representing a minority community here. There is people that are looking, especially elderly folks that are looking for testing. And if you are having this meeting on Wednesday, is there a way like we can participate? And I also want to thank Atrium. I think they're planning to start some mobile testing facilities in the east side of Charlotte. So I'm not sure like where they are, but if any information on that, if you can share it to us, that will be great.
On the mobile testing?
I'll be happy.
Sorry.
On the mobile testing or on the testing plan?
On the testing plan as well as the mobile testing units.
I can get the information on the mobile testing. We've got 2 of those units.
Likewise with Atrium, we've had the east side as well as the west side covered on mobile units in actual test sites as well as respiratory assessment centers as well. So glad to work with you on that.
And also the other follow-up question is like, is the insurance needed for some of these, and do they need to be citizens? Those are some of the questions that we have.
And that's part of the conversation that we need to have as well, to make sure that we've got, if there are requirements around those sorts of things, that we look at how we address those in our community to make sure that those who really need testing have access to it. So that will definitely be part of the conversation.
Yeah, I will tell you that one of the things that we're doing at Atrium, at Novant Health, and I'm sure it's true with Atrium as well, is that as we're going into some of these communities, ethnic communities, one is we're testing people that have symptoms. And where we're going into communities where there are Latino communities, we're not asking for any attestation to whether or not they're U.S. citizens, and we have clinicians there that speak language as well. So just wanted to reflect that.
And the other piece is, my understanding is that whether or not you have insurance is not an issue. So uninsured are being tested.
That's correct.
Yeah.
That's right.
This is Rocio. I can attest to that. I want to thank Atrium and Novant Health for having their mobile units, because they have made it extremely accessible for the immigrant community, not just the Latino community, the immigrant community, to have access to the screening and the testing. And some members have been tested that did not have any symptoms, but had been in contact with other employees and employers that had the test. So I know that you don't necessarily have to have the symptoms to be tested if with the screening it's stated that you may have been at risk. So thank you so much for what you do.
Thank you.
Thank you, Rocio.
Thank you.
Other questions about testing for Gibby, or things that she needs to take into consideration as they put together the testing plan that you think is important?
I have a question. This is Mohammed. I have a question about tracing. I understand that the state has a plan to hire a lot of people to do tracing. What's the status on that?
Well, let me have Gibby talk first about our contact tracing strategy, which we think is pretty good, and then we can get some information to you about the other piece. But Gibby, why don't you talk a little bit about what we're doing on the contact tracing piece?
So we have never stopped contact tracing from the very first case that we had, and we are continuing to do that. We've been lucky in that. I know this is not lucky for the school students, but for us, without school being open, our school nurses has been available to us. We have trained over close to 70 individuals to do contact tracing within our department. Currently, we have 30 working every day doing contact tracing and investigations. We follow up with all of the individuals that are positive until they can be released from isolation, and we also connect with all of those that need to be in quarantine. So right now, we feel really good about the system we have here in Mecklenburg County, and our ability to expand it as there's more testing and potentially more cases. The state system, what they have done is contracted with CCNC as well as the AHEC system. AHEC will be doing training for individuals that will be hired by CCNC and will be available to local health departments that need it. They are starting with 250 positions for the entire state. They have looked to the counties to determine how many counties felt like they needed to have, and that process has already started. And I think they're thinking that by mid-May, these folks will be trained and ready to go. And as I mentioned, at this point, we are not in need of additional contact tracers. And we'll keep on top of that. If that need increases beyond our capacity, we have the ability to work with the state on getting additional support. And there's, for individuals who are interested, there is a website that they can go to that would allow them to apply to be one of these tracers that the state's hiring.
Thanks, Gibby. Mohammed, does that answer your question? Okay.
Yes, ma'am.
And Dina, this is Kevin Monroe in the governor's office. Just added information on the number of traces. The governor referenced this morning that for the 250 positions, they've had 4,000 applicants. And Mohammed, as a point of reference, I did forward your information regarding the Kelly Services request.
Thank you, Kevin.
Sure thing.
Well, that's exciting to know there's so much interest, Kevin, in wanting to participate in that. I think that's a great sign that we'll have more than we need here in Mecklenburg. Other questions about this particular topic? Okay. So just the final thing I wanted to just talk a little bit about is plans to open higher ed. You know, Gibby has been getting, and I know Clay's probably reached out to her as well, from a lot of the higher ed institutions in the county about how to open up higher ed and start planning for the fall semester. And I know that she's going to be convening some groups to start to have some conversations about that. But we did ask Secretary Cohen about that yesterday, and she indicated to us that Bill Roper from the UNC system, who incidentally used to work for the CDC, has been tasked with putting together a plan for higher ed for the state. So we don't know when that's going to come out. I think the conversations that Gibby's having will continue, but we do expect at some point to get some guidance from the state about how to plan for higher ed, because that's going to be coming up. I mean, they need to plan now to be able to start opening in August. That's when a lot of these folks start. So I just wanted to make sure Clay was aware of that. And I don't know, Clay, if you need more information about what's happening at the higher ed level. Okay, maybe he hung up and couldn't stay on. But anyway, I just wanted to let you all know that that's out there, that's, you know.
No, I'm sorry, Dina, I was on mute. I was talking. Sorry.
Okay.
No, but thank you very, very much. You know, we are starting to, not starting, but we're trying to plan to figure out among the several options that we might have to consider whether or not we can open up on time or delayed. And a normal opening for us would be August 24th. And so I'm happy to hear that Gibby and the state folks are convening those folks, because we really need some guidance, particularly as relates to those of us who have residence halls and congregate living arrangements. So thank you very much. Really appreciate your leadership.
You're welcome. So that's all we have on the agenda today. So my takeaways from this is to start to put together some FAQs and guidance based on Andy's stuff and some of the stuff that we've talked about on this call. I'm going to ask Jennifer Weber to help me with the toolkit stuff and help me put that together as well. And then we'll sort of see how this mask thing plays out. We'll have to kind of wait and see on that. But if we can start to put together some information that we can push back out to this group to look at, to try to get us ready for May 8th/May 9th, I think that'd be a great takeaway from this group today. And I don't know if anybody has anything else they'd like us to take into consideration or think about as we start to move forward into phase 1. All right. So we'll be back in touch, and then I'll probably schedule another meeting for us to meet next Monday. That'll be our first weekend where we've got all of our discretionary retailers open. And maybe we can maybe do a little reconnaissance work over the weekend and see how it's going and report back, and we can go from there and monitor our progress. But thank you everybody for participating. It's always a really good, rich conversation. So I appreciate you wanting to be part of this. So
Dina, before we close, I think
Yeah.
it's really important for us to say how grateful we are to you how extraordinary your leadership and Gibby's has been through this, and we're all very grateful to help you out as much as we can.
Thank you. Thanks, guys. Appreciate it. All right. Have a great rest of your day, everyone. Thanks.
You too.
Thanks, Tina.